So when we get into arrhythmia, you will learn how there's only 4 arrhythmias that you can have, and we'll go on to discuss that later. But your heart could beat too fast, too slow. It could have an irregular pattern where the beat isn't like too fast or too slow, but it just doesn't beat in the right pattern. And you could just have palpitations, which means you notice your heartbeat more. So first, I'm going to demonstrate the regular heartbeat. And notice how the tennis ball is going to hit the racket in equal measures. Okay, so now we're going to do too fast. And too slow. And then a regular, which is just going to be a mix of different times. So I can't show you with the temostactic palpitations because I can't stimulate you feeling the heartbeat different, you know. So. But did you guys see the difference in how a regular heartbeat varies from arrhythmia?
Yes.
So now, we'll get out of that paper. So, at the top, you have a formal definition of what heart arrhythmia is. It reads, heart arrhythmia is when the rhythm of the heart is off, caused when the electrical impulses that control the heartbeat don't work properly. So, what causes it is electrical abnormalities. And that would be why your heart beats different. So these electrical abnormalities cause 4 different types of arrhythmia heartbeats. So we talked about one which was too slow, one that's too fast, one that's regular, and one that causes palpitations. So the first one is tachycardia. The second one is bradycardia, and this is when the heart beats too slow. And then irregular is a change of speed and pattern. And then palpitations is the increased awareness of your heartbeat. Palpitation. So, what problems do you think this could cause someone with arrhythmia? If their heartbeat doesn't beat fast enough, what's going to happen?
You could feel
Faint, lightheaded, dizzy. And what's going to happen if their heart beats too fast?
They'll always be out of breath.
They'd always be out of breath, their breathing rate would be much higher. And what happens if it's irregular? Like their heartbeat might take too long between the breath, and then they begin to feel faint or dizzy again. And then if palpitations, it might just feel funny for palpitations, it might just feel funny for them when they do exercise or a certain activity because their heart is going to react.
I have a question.
Yeah.
What's the difference between an irregular heartbeat and just like normal like speed and slowing down of your heartbeat when you're doing this collectively?
So when you have bradycardia, your heart is just going to beat too slow. Like right now, our hearts are beating at a good rate for us. Our resting heart rate might be around like 65. But their heart rate is going to be too slow for them being resting. Or when they exercise, our heart rates are going to elevate, and their heart rates are not going to get as elevated, and so it's not going to allow them to get enough blood.
So how is it different from irregular though?
So irregular is
speed and pattern change. So don't our bodies and our hearts naturally change speed?
So yeah, they're naturally going to change speed, but there might be different patterns in like the speed at which the patterns change. So they could have like boom, 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 and then it might be normal for a little bit, and then it would go back into some different pattern with a different speed to the pattern.
Even if you're resting?
Even if you're resting. So I have arrhythmia, and when I'm resting, have arrhythmia, and it's going to kind of change, but it's now normal because it doesn't change more than it has been in the past. But other people might have severe arrhythmia and it might change for them. And we'll talk about what happens when you have severe arrhythmia. So symptoms of arrhythmia include feeling faint, which we already talked about, short of breath, getting tired easily, and that kind of happen if your heartbeat is too slow, because you really wouldn't be able to do activity like normal people would. You could have chest pain and sweating, be pale, and then there's others too. It's not you having one symptom doesn't mean that someone else is going to have that symptom too. So when we found out I had arrhythmia, I had chest pain, and so we had to go through diagnosing, and we're going to go through that next. So diagnosing arrhythmia. You could do an electrical cardiogram. And this would kind of be like, you would get like little stickies, like pads put in various places on your chest, and then they attach wire to the pads, and it would go into a computer, and the computer would print something that looks like this, which maps your heart rate. So this, it shows a normal heart rate, because you see there's no big change in these. But an abnormal heart rate would look different, and you would be able to see this on the heart rate. It'd be easier to see than if you just taking your pulse or someone taking your heart rate. It'd be harder for them to see because they don't get as much sense of time as when you have it on this, and you can see the spaces. The next way you could find if you have arrhythmia is a Holter monitor. And this is a little device, and you can wear it around your waist, and you usually wear it for 24 or 48 hours. And again, like an electrocardiogram, you are going to get stickies placed on your body, and some have 5 and some have more. And it's going to map your heart rate for however long you wear it. And what you do is you record what you're doing, if you're sleeping, if you feel anything funny, and it can help doctors see your heart rate more than just the 30 seconds that the electrocardiogram sees. It's going to give you much more broad information. And then you can also have a stress test. So this is, you can do it on a bike or a treadmill. And once again, they're going to attach stickies to various places on your chest, and they're going to have you perform different resistance and see how your heart rate and breathing rate changes. So not only are they going to attach pads to your chest, but they're also going to take your oxygen rate, and you're going to be showing or giving them your breath through a machine that can show them how much oxygen. So this is what a stress test might look like. And so they have pads placed on various parts. You got her mask on, and at various times you're going to take your blood pressure too. And then this doctor can see various things that the pads and the breathing rate is taking. And so this person is going to try to bike as long as they can, keeping the pedals per minute at a certain rate. And then she stops and she can no longer keep pedaling. And this is an example of what a Holter monitor would look like. So this is what you would wear around your waist or in your pocket, and it's attached to this wire, just attached to pads, and the pads are like the size of like a big band-aid you might get when you have a bad cut, and it's like really sticky and it's painful to get off. So we've gone through electrocardiogram, stress test, and health monitor, but they can also give you an x-ray. So this is kind of what would, that's right. This would be just what you would do if you got a broken arm or an ankle, and it's going to take a picture of your chest.